Hello everybody, my name is Dr. Jacobs. I'm a doctor of physical therapy. I'm also the inventor of advanced soft tissue release. I'm a cancer survivor and I used to suffer from chronic fatigue, migraines, headaches, and pain before I invented ASTR specialty. Lawerence, tell me what's going on with your back.
I'm having acute pain in the lower lumbar region, a band of pain across my back. When I sit for a long period of times, it stiffens up. If I'm driving, working on the computer, if I lay in the bed for a long period of time, it stiffens up.
So how long this been going on?
It's been going on. Originally, I got hurt maybe 10 years ago, but it's been over the last year. I had an incident playing golf where I had a real spasm across the bottom of my back, knocked me to the ground. Maybe 3 months later, was feeling better, and I had to move a whole bunch of furniture for my sister. She was evacuating her house. And it's been hurting this whole year, and it's gotten to the point where it's so severe now it's affecting my walking, my posture, and my sleep. I can't find a comfortable position to sleep in. I think the problem with my back also started to cause the rest of my body to be out of alignment.
Compensating.
So I'm having problems with the left ankle, my shoulder, playing golf, my elbow's hurting, my shoulder was clicking, just having a whole lot of issues, but it seemed like it all stemmed from that one
from the back. So how much pain do you feel there at worst from 0 to 10? 10 is emergency.
Well, I'm probably in the range. I have a high tolerance to pain, but I'm probably in the 5 range.
5 range. And do you feel constant pain?
Yeah, pretty much constant pain. The constant pain is more on a lower level, say a 2 or 3, say a 3. But if I start to move, or if I get up out of the bed, or if I try to take and start walking, well, if you watch me walk, you can tell right now.
Yeah, we're going to do that. We'll assess your gait. Yeah.
I can't get completely
straight.
Up and down
Yeah,
right
that's why you're slouching forward to compensate, to relieve the pressure. It
feels like my abs are weak, and I know they're not. I know the core. My core strength is not that bad. I can walk. I can do a treadmill for an hour.
Sure.
Going at 3.5 miles an hour walking uphill. So it's not. It's not a core strength issue, but I'm having some kind of tissue or tendon or nerve issue that it makes it difficult for me to get completely upright.
Upright, okay. So what kind of treatment you had before for this issue?
I've been getting chiropractic treatment.
Okay.
I've also been getting massages. And then I've also been doing, I've been doing ice for 40 minutes 3 times a day, and jacuzzis after the ice. So I've been doing a combination of chiro and hydro, just from trying to loosen everything up. Okay. Because that's what I feel like. I feel like in the old days when you lifted too much weight and you caused all your tendons to tighten up. And then that's what I feel like. I feel like the tendons in my back are just too tight. I can't seem to get... It's kind of like before I could get them to crack, I could stretch and get my spine to loosen out. I also use a roller. None of it is.
So you did a lot of stuff. Okay. So we're gonna do ASTR on your back. So your back pain is like a band in the lower back.
Yes.
Okay. So now we're gonna do the motion that aggravate your symptoms, so we can test that after the treatment. So you said lying on your back. So I want you to lie on your back.
If I'm lying down in bed.
Oh, there you go.
Right there.
Okay. Sorry.
If I'm lying down.
How much pain?
Now, it's not so much pain as it is stiffness, but then again, I have a high tolerance to pain, so it's hard to tell, but it goes from 5 to like 7.
Okay.
Okay. So when I get here, right there.
Okay.
That's one of the things.
So that's one of the things. What the other motion?
The other thing is when I'm walking.
Okay.
Normally I walk.
Well, you're bending when you walk. Yeah. Let's come this way.
I normally walk from the core.
Okay.
So I normally take and force my core up, but right now it hurts so much.
Yeah, you're definitely bending. Yeah. Turn
now,
around.
just laying down and getting up, I actually feel better than before.
Yeah.
But it's sore. But you can understand when I'm walking.
Turn around and, we can see you're really tilting forward. And you normally, have a good posture. Yeah. Okay. So let's do some range of motion and see how you're doing with that. You let me know when you feel pain, okay?
Okay.
All right. So slide your hands down and your legs and just bend forward.
Oh, this way?
Yeah. And see how far. And let me know when the pain increases. So the pain starts by your ankle.
Right,
okay. All right. Backward.
Okay. This way?
Yeah. Going backward. Extension.
Backward. Right there.
How much pain?
Well, it's probably 6.
Okay, all right. And don't aggravate it.
Okay.
Okay, so twist to the...
That's my problem. I'm accustomed to when I feel something, stretching, breathing, and stretching past.
You're gonna cause more injury this way, so we don't want to aggravate the symptoms. So twist to the right. How's that?
That's not too bad. If I get wider, I can twist more.
Okay.
I feel it when I'm under full extension. Okay.
And go to the other side.
Now that side, I feel more of it.
You feel it more?
Well, that's
Is it
the
more?
golf swing.
More.
That's
So
from doing that for so long.
yeah,
so
we gotta do the
here,
work on your golf swing.
Feel it there. Okay.
Yeah. So side bend to the left and right.
Now there, I can start feeling that in the lower back.
In the lower back, okay. And the other side.
Man, see, it's cracking.
You twist it, okay.
Like
All right. So everything we do should not aggravate your symptoms. So you feel it's both sides the same. And
you know, it moves around. It'll be worse on one side, and then the next day it seems to be worse on the other side. But
okay.
It's more towards the right side, from the center radiating to the right.
Okay.
A little less on distance-wise on the left.
Okay. Do you feel comfortable lying on your stomach? Or that
you know what? Lying on my stomach feels okay, but when I'm flat on my back, it seems to hurt in the
okay.
middle.
Let's actually lie on the side. Okay, so I want you to lie on the left side. Pillow between your knees. Okay, bend your knee.
First time ever I got a massage laying on the floor. When the massage was over with, it was worse. I have a therapist. I have a lady I've been going to for years, and she's good. You know what I mean?
Yeah.
She's really good. She knows my body well, but it was the first time in years. It finished the massage, and it was worse. I felt worse after she finished.
Well, massage based on the study is temporary pain relief. It's not
right
addressing the source of the problem. So,
and here's the problem. I've been hurting so much I can't train. So my stomach is getting weaker. I haven't exercised in a month. I've been taking it easy for a month.
So can you tell us about your sports background?
In high school, I played 4 sports. I played football and basketball, baseball and golf.
Okay.
Professionally, I played football and golf. I still play golf now. That's the only thing I can play.
Okay.
I spent more time in my professional football career in the hospital than I did on the field. Let's say I was a tackling dummy.
Yeah.
But also, after my sports career from a professional standpoint was over, I played city basketball and softball, fast pitch. I've always bowling and golf. I play golf 4 or 5 times a week now up until the last month. It's just been too painful to play.
Yeah, okay. So you remember the fascia we talked about, the Spider-Man suit wrapping the entire body?
Yes.
Okay, so I'm working actually on the superficial fascia now. I just released it, that was tight here. So it should move like this. This is actually good mobility here. Feel the tightness here?
Yes.
Comparing to this. And you can see it in the camera here. This is normal fascia movement. And here, this is not moving at all. So I'm gonna release it with ASTR instruments.
Okay.
So to see how long it's gonna take to release it. Feel the mobility now?
Yeah.
You feel
better?
it? Yeah. So it's easy to release it with that instrument. Okay. Let me know if that's painful, okay? So your pain is like this,
exactly,
going down to your glutes.
You know what? It's not. If the pain is right there, and sometimes it'll go in here, but not too much. I thought it was the glute minimus. So I started doing glute minimus exercises, but the glute minimus isn't bothering me.
Well,
because
exercise is not gonna break the scar tissue or release the fascia.
Got you.
Okay. You feel the tightness here?
Yes.
Okay. So I can release it now. Okay. Feel the mobility now. Okay. And you said you had like hernia surgeries.
Yeah.
Any pain with what I'm doing? It's okay.
No.
How does this feel?
It feels good.
Mm-hmm.
You know, I feel a little pressure against the skin, but it's not any pain.
Okay. Alright, so now I'm gonna do deep flush release. Okay. Relax.
Huh.
You can relax your arm. Okay. Feel the tightness here?
Oh, yeah.
Okay. So I'm using a different instrument to be deep and make sure it's not painful, okay?
Huh.
How does it feel now?
It's looser. It's amazing that something that has such a light touch to it can do so much. You understand what I'm saying? I've been mentally trained a whole different way my whole life. No pain, no gain. So, you know, I've been trying to stretch my way and exercise my way out of hurting.
Yeah, well, I'm not really fan of this philosophy because I think about this way. Well, God gave us the pain signal for a good reason, okay? It's similar to your car check engine signal, okay? So if you have the signal light on, that's indicating you need to check your engine, there's two options you have. One is cover the check engine signal and just drive
until it blows up.
Hope for the best, you know, I hope you're the best too, yeah. And two, just fix it and the light will disappear.
Right.
That's why I disagree with just push the pain. We need to know why you're feeling pain.
Right, exactly.
If there's nothing wrong, you should not feel pain. But if we push the pain, that might cause tear, more damage, you know. So that's a different philosophy. But it should be like no soreness, no gain. When you do any training,
right.
If you did not feel you're working your muscle, you're not working enough. You know,
right.
Like feeling the soreness from workout, and you know that, you know.
But that's a different kind of pain too. It feels good because once you start breaking the lactic acid up, you don't feel the pain anymore. You just realize the muscle is that way because it's constricted. Because there's no, you're so full of blood. That normally they're flaccid like mine. I have no blood in them right now. But when you're full of blood, the minute that you start stretching and you start exercising again, that pain goes away. There's a difference between feeling sore and good sore that you feel from exercising
and pain,
and then feeling pain.
Okay. It's gonna feel cold, okay? I'm gonna work now on your scar tissue. Okay, sorry. No, you feel that?
Yeah.
Okay, there you go. You feel this? You feel this one here?
Yeah.
That's a scar tissue. So you have like a marble feeling. You feel that?
Yeah, I feel it. I've been trying to get it out with the roller for the last year.
It doesn't work. For the last year, okay. Yeah, I think 1 year is enough for a trial. We should try something different.
Look, Doc, think about it. I left Studio City and drove all the way to Irvine on the 5, went to repairs. It took me an hour and a half because I knew I had to do something different. Okay? And I knew there has to be a better way. And unfortunately, I thank God that my parents get me to be an open-minded individual and to think that things are not wrong, they're different. And by having an open mind, then you can try different things. There's cultures that have been around for 5,000 to 6,000 years practicing different kinds of forms of medicine. And here we've been around 240 years. Okay, so obviously Western medicine doesn't have all of the answers. But there are individuals who have taken in, like yourself, dedicated their lives and their time to studying the human condition and finding better ways for it to work. So we also believe nothing beats a failure but a try. I saw people in pain get relief. I saw it. I watched it. I watched it with my own eyes. And I'm a professional actor, so I know these people on stage. It wasn't actors. These were people in pain.
I cannot get 170 actors to act treatment.
No, because first of all, they're not going to pay. They're not going to pay. You ain't going to pay them. I make $2,500 a day. You ain't paying me to come and show up.
No. So.
But I do understand the physiology of what's happening and why it works. I remember, I have a guy that I worked with when I was playing football. I mean, a lot of times when you watch a football game, you'll see a player go down, and then you'll see the trainers run out on the field, and they'll get around the player. What they're doing is they have a specialist that's going out realigning the ligaments. That's all they do is put the ligament back in place. And for the athletes at that level, they have so much muscularity, and with the adrenaline flowing, once they put the ligament back in place, they can play. They'll finish playing. Now, 4 hours later, they're gonna feel it way worse. But this guy's been working on me for years. But it's so painful to get that done, and I'm like, this can't. You shouldn't have to go through pain for healing. I've been reading more about Chinese theories, and even with acupuncture, acupuncturists will tell you if they're giving you acupuncture and it starts hurting, they're going to stop because they realize there's an information.
There's information, and this is actually pure science. What I'm doing, it's a basic based on the healing cycle. That's actually. It's scar tissue.
But I can feel all the raisins in the bumps when you're going up and down like this. I can feel you. I can feel you going over like driving a car over bumps in the road.
Yeah. So it's basically if the person, even a medical provider, if they understand the healing cycle, scar tissue is part of our survival. So when we have external cuts, our body has to build the scar tissue to heal.
Right.
If our body does not build the scar tissue, it's open wound susceptible for infection.
Infection, and that's what kills more people. Right, pathogens. Pathogens that come from the air is what kills more people. An open infection, an open wound will kill you faster than anything.
Yeah.
Because it gets into your blood system and poisons you. It kills you.
The same thing happens internally. You have any accident, trauma, or poor posture or surgery. But because people do not see it and doctors do not see it, they don't visualize it. It's internally, and we actually can prove it very easily with palpation and with the instrument. You can feel the bumps.
Right.
It's really
not only that. I guarantee you, if you put an infrared on the body. And before you do what you're doing, you can see the heat build up from where all the blockage is.
That's correct.
And I guarantee you, after you do, look, man, I've been trying to get the masseuse to get that one knot that you got out for about 6 months.
You cannot get it with the hands. I feel bad for her, It's hard to bring it with the hands. I feel bad for me.
No, I go to the Thai woman. She's using her feet.
Oh, no. Be careful. I don't think it's a good idea.
Well, no, listen, we're
jumping and
we're already trying something different.
Make sure you have a health insurance and life insurance when you do that. Don't try that at home, okay? Feet and jumping. Okay. So it's very easy with those instruments actually to break the scar tissue. It's, as long as
I can feel it right now and it doesn't feel painful. I can feel the pressure, I can feel the knot moving, but it doesn't hurt though. Okay, I can feel it, but it doesn't hurt. There's a difference. As opposed to what I've been doing is having a wife just apply pressure and then okay.
Yeah. Okay. So actually, let's have you let's test again and see how you feel. So the testing was lying on your back and sitting up. That's one of them.
Oh wow, it's nice and warm. I can feel, I can already feel some space in the back.
Yeah. Okay. So.
But I'm up a lot farther before the pain started. And it's a lot less painful.
Faster.
Right, much faster.
So what happened?
Before, when I first came up, when I got right here, it would start hurting. Now, I'm able to move a lot more.
Okay, where do you in the back? Okay, so let me do one more thing and see if we can get this without pain. Okay. In the back. Is it okay to work? No, in your back.
Oh yeah.
Is it okay to work on your stomach?
Bro, you can do whatever you got to do, Doc. Okay, so, I'm here to get help.
Just relax. Okay, so I'm doing this because you said you had herniation and mesh here. Yeah. So I want to make sure that everything is loose, but make sure it's not painful, okay? And so a lot of patients, a lot of people would think like, why you work on the stomach while the pain in the back?
Because this front and the back is connected.
It's one piece.
It's one piece, yes,
of course. Divide it. And if you have a surgery or like especially C-section patient, they usually have a lot of tightness, scar tissue here. And you see the tightness here, the scar tissue here actually, but the tightness
pulls in the back, right?
And that's usually the
for every action is an opposite and equal reaction. The body is unilateral. I understand that. It's two equal halves. So if you do something on one piece, it's going to affect something. That's why I realized as long as my legs are not functioning properly, the knee and the ankle, that I'm always going to eventually come back to having problems because you're out of balance. That means when I'm moving, I'm out of balance. See, that doesn't hurt. That feels good. It's not painful. It actually feels good. It feels like the tendon is so tight. I can feel you as you're squeezing it. I can feel it releasing.
Beautiful. That's good. That's the goal. So I'm doing actually the release with the ASTR instrument. Okay. How does that feel?
Yeah, it feels a lot better. It's amazing that you went right there.
Yeah.
And remember, I've been feeling like my stomach is going to burst.
Yep, because the tightness is making it contract like this. Yeah.
Yeah, see, that hurts a little bit.
Sorry.
No, it's okay. But it hurts in a good sort of way. It was like, okay.
How does that feel now?
Yeah. A lot looser. Yeah, I feel the difference.
Yeah. Compared to this side that we did not work on.
Right.
It's a little bit tight here. Oh, sorry.
No, it's okay. It didn't hurt.
Make sure it's not painful, okay?
No, it didn't hurt.
Okay. So I'm working just doing deep release. Okay. As you see, I use my hand for assessment and the instrument
for release.
For the release to save my hand. You know. And
I had a good friend of mine who was a chiropractor for 20 years. He was my chiropractor, and then the guy who's been doing chiro work on me was his assistant. He had to retire because the manipulation on his hands. After 20 years of, he said, Jamie, his name was Jamie, and Jamie was like one of the top. He did a lot of physiology and a lot of physical stretching and relaxation therapy with his patients. But he had great hands, but he destroyed his hands.
I feel bad for him because, and that's one, like when I started to work on an instrument, like was the second year from practicing, because my hand was killing me.
Right.
And I was like, I cannot do that for 4 or 5 years, you know. And it's not as accurate as an instrument because you get tired. So either you help patient or hurt yourself. So you choose one, you know. Sorry. Okay. So let's actually, you can cover it, and I want you to sit up and tell me how you feel.
Oh, that's a lot better.
Yeah.
That's a lot better. Just a little tiny bit.
Yeah.
It's almost like the gate was now it's almost like the gate is loose. Yes, I can still feel a little bit.
You feel
just a little bit. Just
right there? Okay.
Just there. Like when I'm right.
How much from 0 to 10?
When I'm like 7? No, it was 7. Now it's like 2. 2,
where do you feel it?
Right here. I can show you. Right. I feel a little bit in the core
it's like
and then a little bit on the back.
Okay. That's nice. Bend your knees and you can relax. Okay. Alright, I'm doing a lot of work here. Actually in the front more than the back. Is that too much here?
No. Now, question. If you're doing it and I'm feeling a little pain, just to say, okay.
Gotcha. I don't want to cause inflammation.
Gotcha.
So, we want to work on the proliferation stage. We don't want to cause inflammation.
Gotcha.
So, yeah, feel that?
Yeah.
Feel that? I don't know if it's too much. Did anyone work on your stomach?
Never.
Yeah, that's why it did not fix it.
Never. Not since I've had the hernia surgery. Never.
Yeah. And when did you have the hernia surgery?
Oh, that was probably 15 years ago.
Yeah, I had a lot of patients like that. Everybody focused on the back, but I'm like, and they leave, and the front causing the...
You know, it's only the last couple of years that I got kind of fat. Before I had abs, because I used to train all the time. But that's another thing too. I got tired of exercising 4, 5, 6 hours a day. It didn't make sense to me. Like something's not right. No.
You feel the...
I can feel the scar tissue breaking up. I can actually feel
the breaking.
Yeah.
The scar tissue.
Like right there just now when you hit it.
Yep. You're very intuitive to your body. That's good, actually. So yeah, that's very typical that when we actually release it with this instrument, it's the design and the material of the instrument that make it easy to break it fast.
You can feel it. It's amazing. No.
You know if it's too much and all around this area. Sorry.
No, it's not too much. It's just tender. It's not. It doesn't really hurt. Like I could easily do way more than that. It's just certain spots that you hit. It is tender. It's amazing.
You feel that crunchy?
Yeah.
Yeah. It's just scar tissue. Yeah. I'm not surprised. It's very normal to have a scar tissue after any surgery.
Of course.
It's part of healing. The problem is when you have too much scar tissue. So instead of the muscle act like a rubber band, when it contracts and relaxes, it does this. The scar tissue, it's like a knot in the rubber band. So when the muscles start to contract, it does not stretch much. And that's causes restriction in the range of motion, compensating your back. And if it's too much, it could compress on nerve artery, like mimic some nerve pain. And we see that frequently with patients like sciatica and stuff like that. Everybody look in the back, but they ignore the scar tissue and makes a very good amount of number of patients. It's actually not the spine; it's the performance or the scar tissue in the back compressing.
I got another thing I want to tell you about my big toe, the right big toe. I have a stress fracture, what they call turf toe, from playing on AstroTurf. That toe rarely cracks. I can rarely get that joint to crack. I just want to let you know about that. Perhaps later on when you start working on that. Okay, because it's not normal for my feet. Better.
Like right now. Now you're moving fast. Are you trying to show off now?
Oh yeah. No. I can actually activate the muscles a lot better.
Yeah. How was that? Let's stand up and we're gonna get the walk too.
Oh yeah.
Oh, look at standing.
Oh yeah.
Go back.
Yeah. Doc. I'm about 95% back to normal. That's my normal gait.
Yeah.
You know what I mean? And I know how to walk because I had the pelvis
faster now.
And that's my normal walking speed, but I know my normal gait, and I walk heel to toe. I walk heel to toe because I know I'm supposed to. I can still feel just a tiny
tightness.
Nothing before compared to, bro, I couldn't stand up.
So bending, you were by your ankle. Let's try it again and see how that feels. How's that?
I just feel a little bit here.
Tightness or pain?
No, just a little tightness, not pain.
Not pain. That's good.
Okay.
That's good.
Just a little tightness.
Yeah, that's good.
And then going down here, I can go all the way to the floor.
That's beautiful. Get the whole thing down to the floor. Yeah, try it again. Oh.
You can go down
to the floor. Beautiful. Yeah, that's good.
As a matter of fact.
How was that? All right. So what do you think about ASTR treatment?
I think I should have been here a year ago.
All right. Yeah. Thank you.
I feel much better. Just a little tightness, but no pain.
No pain. No. Feel free to subscribe to my channel. You will get updates about helpful tips and tricks on how to relieve pain. Also, there's over 150 videos that for ASTR treatment, real ASTR treatment. You can actually see the instrument that I invented and the result I get with my patient. Also, if you are a healthcare provider and you are interested to be ASTR licensed provider, feel free to click the link below to register for next class. I also included a link for my TEDx talks that I shared how I discover ASTR treatment. See you soon.